If you have allergies, you may have noticed some serious sinus problems kick into high gear in the last few weeks.
Well, if those sinus problems don't diminish, you might be a candidate for a breakthrough procedure now being performed by local doctors. Local 12 medical reporter Liz Bonos tells us more about it in today's Medical Edge. Good morning.
I'm glad you had this story because I thought I was crazy with my sinuses, scratches,
All of a sudden, didn't it just seem like people,
2 weeks ago?
I even had people say, like, well, this is a better month, and then boom, you spoke too soon.
Yeah.
I feel your pain. If you suffer from what's commonly called the Cincinnati sinuses, allergies and colds tend to make you feel even worse if you already have those as well. Immediate treatment with over-the-counter medications can help ease some of these symptoms, but if you have chronic sinus infections from any of these allergies, colds, you might be a candidate for a newer procedure now available at the University of Cincinnati. It is called balloon sinuplasty, and as this graphic, courtesy of a Clarence, shows, it's a procedure much like doctors perform in the heart. A tiny catheter or needle is placed into the sinus cavity, and a balloon at the end of it is inflated. This opens the airway and alleviates sinus pressure and pain. Now, you see this tool right here? It's what's new about this procedure. The procedure's been around for a while, but Dr. Alan Seiden, an ear, nose, and throat specialist, says new technology is making it easier to perform this. That little light right on the very end of that tool allows doctors to see without x-ray guidance how to navigate in some of the tougher sinus areas. This way they can perform this procedure.
Right now we use it most often for opening the frontal sinus, which has been traditionally the most difficult sinus to open, and that's the sinus that's located up in your forehead. It's also used to open the maxillary sinus, which is in the cheek, and even occasionally the sphenoid sinus, which is way in the back.
Now, the good news is, as this gets easier, it doesn't always have to be the court of last resort, and more people can get sinus relief with this balloon procedure. If you have headaches, pain and pressure in your sinuses, chronic sinus symptoms, you've not had successful treatment, ask your primary care doctor about seeing a sinus specialist. In most cases, if other treatments have failed, the procedure is covered by your medical insurance plan. Obviously, you want to try the medications and that kind of thing first, but this is when you repeat and you keep getting infections and don't go away. And I've talked to people who've had this, and they said, I had headaches for years. It got so bad I couldn't do things with my family. This was the only thing to get relief. You think about it, it just opens the airway, just like the heart.
Yeah, I was going to say, my dad's a cardiologist, and I've seen similar video, but inside the heart. So
and it opens it up.
Interesting. Now it's all spreading.
Yes, yeah, and it, that's always the good thing about discoveries. Usually when they're applicable in one area, you can find a way to use them in another. All right, good stuff.